Hello everyone. In this session, I will be speaking about the advanced VP shunt systems available in India. So if you are watching this video, probably you are one of your known person who has been suffering from hydrocephalus and you are contemplating a VP shunt surgery for the treatment of hydrocephalus. So if you want to know which is the best shunt system for you, watch this video until the end. There are n number of shunt systems available. But in India, this video I'm specifically concentrating from India because the number of popular shunt systems available in India are limited. So I'm focusing this video for patients from India. So when you are an Indian and you are contemplating a shunt surgery, this video will guide you to understand what are the shunt systems available, and in coordination with your own treating neurosurgeon, you can make a decision as to which shunt system is best for you. Okay, let me share some video. Before I tell you what are the shunt systems available, you should try to understand what is a shunt and what are the complications. So we have different kinds of shunt systems to countervent these complications. So see this image. I have searched on Google for a VP shunt. So this is the diagram where you can show a VP shunt. Follow my cursor. Follow my arrow. This is the VP shunt. As you can see over here. Sorry. So this tube, gray color tube, which is placed from the brain into the peritoneal cavity, is the VP shunt. So one of the most common complications of the VP shunt is shunt overdrainage and shunt block. Shunt block is a common complication, and the incidence of shunt blockade is common with all the varieties of the shunt. So second one is overdrainage of the VP shunt. What is overdrainage? Why is the shunt placed? Whenever there is some obstruction to the CSF flow in the brain and there is accumulation of excessive CSF in the brain, we place a tube to bypass this obstruction so that this excess fluid from the brain goes into the abdomen. So the shunt systems are designed in such a way that it lets the fluid from the brain to go into the peritoneal cavity only when the fluid is excess. That is, brain should have some optimum amount of fluid present within itself. Sometimes what happens is the shunt overdrains. That is, even when the CSF, the fluid within the brain is not excessive, the fluid tends to drain into the peritoneal cavity. So this is known as overdrainage. So to prevent this overdrainage, we have two systems available in the Indian market. One kind of systems are known as the programmable shunt. Second kind of systems are known as the anti-siphon device. What are they? Programmable shunt. Let me type in the search programmable shunt. Let me show you what is a programmable shunt. Yeah, all these are programmable shunt. So how does a programmable, this is the most common, this is known as the Hakim valve. Two kinds of programmable shunt are available in India. One is the Codman-Hakim programmable valve. Second one is a Medtronic valve. These are the two valves which are available in India. So what is the role of this valve? So these are known as the programmable valve. Most commonly put valves are known as the non-programmable valve or a fixed pressure valve. So what is a fixed pressure valve? In majority of the population, the intracranial pressure is within a narrow range. So these fixed pressure valves ensure that our intracranial pressure is within this narrow range. So this works for the majority of the patients, and the shunts drain appropriately at this fixed range. But for some patients, due to unknown reasons, or sometimes due to known reasons, the pressure within the brain, normal pressure within the brain is outside this normal range. Either the normal pressure which that particular patient's brain can withstand is either lower or higher than this normal pressure. So either they overdrain or underdrain at this fixed pressure. So what happens? If you put a fixed pressure shunt in these patients, if the shunt overdrains or the underdrains, you will have to revise the shunt. You will have to redo the shunt. You'll have to place the shunt with a higher pressure, the lower pressure. To circumvent this one, we have a programmable shunt. What is a programmable shunt? This is the Codman programmable one. So this valve is programmable. What is programmable? I will show you. Let's see this picture. Can you see this one? Can you see this valve? I will look for a better picture. Yeah, this is a better picture. So this is the valve, extra of the valve after implantation. This is the pressure within the valve. You can see the pressures within the valve can be set at 30 mm of mercury, 30, 40, 50, 60, 70, 80, 90 to 200. So you can pinpoint the pressure. You can adjust the pressure. You can adjust the pressure without any surgery, and the adjustment of pressure hardly takes 5 minutes. So if the shunt is overdraining, we increase the pressure higher up. If the shunt is underdraining, we decrease the pressure lower down. Let me show one video which is done. You will understand how the pressure is adjusted. So this video I picked up from the YouTube. See, this is a patient where the pressure is being adjusted. This what the doctor is holding is a device which is present in my hand. I am putting this device over the valve, and this is external machine, and the pressure adjustment is done. That's all. This is the machine. This is just like a Bluetooth. Let me replay it. I just keep this Bluetooth over that device, over the shunt. In my OPD, you put the adjustments, switch on the machine, the shunt is adjusted. That's so that's all. The pressure adjustment is as simple as that. So this ensures me to prevent over drainage or under drainage in at least 95% of the patients. Okay. What about the remaining 5%? As I've shown in the picture, the shunt can be adjusted in increments of 30, 40, 50, 60, 70, not in between. Sometimes the gravity comes into picture. When I adjust the pressure, is fine. But as soon as it starts walking or it starts sleeping from sitting position, the gravity comes into action. This changes the pressure within the shunt system, within the brain. So when the patient sits, it tends to overdrain. When the patient sleeps, it tends to drain normally or underdrain. So if I feel, or if the patient's gravity is changing the amount of flow within the shunt, then I use a device which is known as anti-siphon device. As the name implies, this neutralizes the effect of gravity. So this device is put in those patients where there's wide fluctuation with CSF flow because of gravity. So basically there are three kinds of shunt. One is a fixed pressure shunt, which I do in majority of the patient because it's cost economical. It's very cheaper. Particularly in India, the cost of a fixed pressure shunt is less than 10,000. So it comes to be very cheaper and economical, and it works really well in 90% of the patients. And remaining patients, I will either use a programmable shunt or a programmable shunt with an anti-siphon device. So these will help me prevent the over drainage and under drainage, and also prevent the counteract the effects of gravity. Second most complication of a shunt surgery is infection. We have a kind of shunt which is known as Bacticil, which is bacterial impregnated shunt. So this decreases the incidence of shunt infections by some extent, but it doesn't mean that it completely neutralizes the shunt infection. So, but it's costly. So if the patient is affordable, I would put a Bacticil, which is bacterial impregnated shunt, because it adds on to the cost but doesn't cause any side effects. So if the patient is not affordable, I would definitely use a normal shunt. So probably after seeing this video, you will understand that the three common kinds of shunt systems available in India, and you will discuss with your neurosurgeon regarding the shunt system which you want. And if you want to contact me for any other queries, contact on the WhatsApp number which is given below, which is present on the thumbnail. Do subscribe for my channel. Thank you.